Hurricane Maria devastated Puerto Rico. In September of 2017, it is estimated that as many as 2,900 people died and billions of dollars in damage was left behind. But there's now another problem facing the island. More than 100 bodies are still awaiting autopsy, more than a year and a half after the hurricane. The Puerto Rican government now says it cannot handle the workload without immediate assistance from the federal government. On Friday, Governor Ricardo Rosselló met with Health and Human Services officials in Washington. He had come to Washington to attend the State of the Union, but today he met with HHS to ask for help. He specifically is asking for more pathologists, forensic experts, and support staff to help address the demand on the island. Now tonight, CBS News is reporting the story of Dr. Abby Benitez. She's a school administrator in New Haven, Connecticut, who spent more than 18 days trying to claim her late husband's body. He suffered a stroke on the island, died. She flew down there as fast as she could. And her story of trying to claim her husband's body is one that we think you should hear. Dr. Benitez joins us now via FaceTime from Fajardo, Puerto Rico. Dr. Benitez, thank you for your time. I wanted people to hear from you tonight because I've seen the videos of family members wailing outside the forensic center as they try to get answers on when they can claim their family member's body. I've heard the stories of the families who can't have an open casket funeral because when they finally get their loved one's body, decomposition has set in. I want to know the story of your husband and what it was like to try and get him out of that facility.
So, David, we had to call every single day. We were never able to see his body, even though we arrived less than 24 hours. We were not able to see him. We only saw a picture. And to say the least, we were devastated. But the worst of all was not knowing, the uncertainty that we really didn't know if we were going to be able to see him before we cremated. I cannot explain to you the feeling of lack of dignity that all of our family felt for him. William was a sweet man who worked really hard to make humanity better. And we all felt that not knowing when he would be released to us, or if they had the personnel, the resources to process his body, it was excruciating. But not only that, we as a family felt that Puerto Rico was ignored by the rest of the nation, because I started tweeting the diaspora. I said, please, somebody, come down, help us. Because I'm one case of many hundreds.
I have to tell you, Dr. Benitez, you know, because you and I talked right before this interview, I've heard from so many relatives who have been trying to claim the body of their loved one and are being told it may take 4 weeks, 8 weeks, it may take months. Some people have been waiting more than a year just to get a death certificate. How were you finally able to claim your husband's body? I know you wanted to cremate him, and I know you said you finally were able to see him before the cremation, and in fact there was decomposition because of the time it took to be able to get him back to you.
So we could not see him as just close. I had to be in a position that was higher so I could see inside the body bag to make sure that his face was him. That, to tell you the truth, was a little bit difficult for us. We had to be covered. We had we couldn't really say goodbye to William. I just wanted to make sure that it was him. And it took me days to recuperate from that. and I'm still having a little bit of nightmares about how I just couldn't really properly say goodbye to my husband.
Dr. Benitez, I can't thank you enough for coming on to tell us the story of your husband, William Benitez, who, by the way, is believed to have drowned on the island, a man who was an expert swimmer, taught others to swim, likely had some type of emergency. And right now, Dr. Benitez is trying to figure out exactly what led to his drowning. Did he have a medical emergency that led to the drowning? Dr. Benitez, thank you. And if there's anything we can do for you, let us know.
Thank you very much, David.
Listen, no one is suggesting here, well, there he is, Camilo, my colleague, who helped write the article. I'm well, thank you. Camilo Montoya-Galvez works for us in our D.C. bureau. Camilo, what I was going to say, I didn't realize they were going to pop you up on the screen, but nobody's suggesting that the Puerto Rico government or the folks at the morgue are intentionally delaying anything of the process. They are understaffed. They are without the resources. They're even without enough equipment to properly process this backlog. So I want to work through the web article that was just posted on CBSNews.com about 20 minutes ago that you and I collaborated on. First of all, let's start off with this question. How many bodies right now are a part of the backlog?
Well, listen, David, I talked to the spokesperson for Governor Ricardo Rosselló. He told me the number stands at 132. But David, this doesn't take into account the number of approximately 100 bodies which have not been identified by family members. So the actual backlog, the number stands at over 200.
You also talked to somebody whose name we're not going to give out because he asked us to withhold it. But it's a person who works inside the morgue and has a lot of very valuable information. Tell the audience what he told you today.
Yeah, so we wanted to get testimony and firsthand accounts from people who actually do this kind of work, right? Because we hear from family, we hear from people like Dr. Benitez who have very compelling testimonies of how frustrating and very difficult it is to wait weeks, even a month, to receive the body of your loved ones who have passed away. So we wanted to hear from these people. We spoke to an employee at the Forensics Institute, which obviously covers the whole island, who spoke to us on background. He does not disclose his name because he was not authorized to talk to us. He told us that the backlog has been there for years. This is not a new problem. This was worsened, obviously, by Hurricanes Maria and Irma, by the deaths toll, by the chaos they ensued, but also that this has been going on forever. And the chief catalyst of this problem, obviously, is understaffing. You know, he tells me morale is very low among his employees. He says they're very concerned about the low benefits they have, the low pay, the reports they see on TV of families just crying out and speaking their mind because obviously they're very frustrated about this, and some of them take out their anger on them, right? So he tells me that the morale in his institute is very low, and he tells me that they quickly need help from the federal government in terms of pathologists, support staff, more forensic experts, because he tells me that the catalyst of this problem is the same root that causes other problems in the island, which is the exodus of Puerto Ricans going to the mainland for better jobs. He tells me pathologists leave to the mainland U.S. because obviously the pay in Puerto Rico, it's not nearly the same.
So this is important for the context of what Camilo's bringing up. After the hurricane, there was a backlog of bodies. FEMA brought in these refrigerated trailers that were used to house some bodies that had been there for a year or two before the hurricane. Last year, sometime in the fall, the federal government sent pathologists, transcriptionists, and translators down to Puerto Rico, and they were able to complete a mission. More than 180 bodies were autopsied, and the federal government left and turned all operations back over to Puerto Rico, so to speak. Well, now there's another backlog. So the governor being in Washington today asking for help is specifically asking for help processing the backlog that currently exists. But Camilo, it seems to me, based on the reporting that you and I have done over the last couple of days, no matter how much Puerto Rico tries to get a hand on this, they're not able to adequately process this backlog, and that's why you've got people like Dr. Benitez who are waiting close to a month to claim their loved ones' remains.
That's an excellent point, David. So as you mentioned, the governor was here in Washington. He attended the State of the Union as the guest for Senator Chuck Schumer, the minority leader in the Senate. And he met with Department of Health and Human Services officials today to follow up on a request. It was a follow-up meeting for a request the Puerto Rican government made to the federal government last December, actually, for more support staff, for more pathologists, for more forensic experts. And his spokesperson told me, the governor's spokesperson told me that if they get the help they're requesting, and if they get it in the amount of time that they're requesting, they can stabilize the backlog in a period of between 90 and 120 days.
Oh, interesting.
But,
okay.
Again, the caveat is that they need this help immediately.
I didn't know they were putting a timetable. And we should also tell you that once HHS says we will send another round, another forensic management team to process the backlog, FEMA is actually the one that's going to pay the bill, because last year FEMA paid $2.7 million to have the backlog processed. And again, there's a backlog. Listen, this was an important story we wanted to bring to you as we continue our coverage of Puerto Rico. Camilo Montoya-Galvez, thank you for your time. Thank you for your collaboration on this work. It's an important story that I think people needed to hear.
Thank you, David.
Thank you. You can read more of our reporting on the ongoing crisis in Puerto Rico at cbsnews.com. The article is up right now. Coming up.